Tom, how you doing?
I'm alright, yeah. I'm doing not bad.
Okay. Well, I think last week you said that you were thinking about making some changes with regard to cutting down on your drinking.
Yeah, I'm not really sure.
Okay, so you're not sure whether you want to go ahead with that or not.
Yeah, so I suppose a few people have said it to me that I should maybe think about it, but I'm just really not sure about it.
Okay. Well, I think it'd be a really good idea if we did this exercise, and I picked this up at a training course I went to a couple of weeks ago. So what we do is we put in the behaviour that you're thinking about changing, and then we put in the reasons for and against making a change and the reasons for and against staying the same, and at the end we just look at an overall outcome and decide whether you want to make the change. Is that okay?
Yeah, okay.
Okay. So I guess we put in here the behaviour thinking about changing is drinking, yeah?
Yeah, I suppose.
Okay. So, what is working for you now? Why do you like drinking?
It relaxes me, helps me relax, all the stress and things I've kind of got going on at the moment.
Mm-hmm.
Yeah, it's nice just to come in and have a nice tin of beer or something, or go down to the pubs with my mates and just not think about things that are going on in my life.
Okay. So you go down to the pub and it relaxes you.
Yeah.
And what are the downsides of what you're doing right now? So that's drinking.
Well, probably I'm spending lots of money on it. I mean, I am
Okay.
spending lots of money.
And it's really expensive, isn't it?
Yeah, it can be.
What else?
I mean, it's been mentioned to me about when I'm getting the time to go see my kids. You know, some people are saying, you know, if I've been drinking, it might be a problem. You know, they don't, you know, that they think maybe I'm smelling alcohol sometimes, or they can smell it on me, and
Yeah.
so, you know, that's a problem.
And they're not going to let you see your kids, are they, if you keep smelling?
Well, I mean, I hope it doesn't get to that stage, but they have said to me that it might be a problem, you know, if I am smelling a drink. So.
Yeah, so people are judging you. What else is bad about drinking?
I suppose I've heard about there's health things about drinking people talk about, but I'm not really sure what they are.
Things like, you know, you're at more risk of lots of diseases and cardiovascular disease, diabetes, even some sorts of cancer.
I mean, so I've heard, but I don't really know much about those things.
Okay, well we can talk more about all the actual quite serious risks later on. Anything else?
No, I don't think so.
Are you sure?
Yeah.
No more downsides?
No.
Okay. So if you were to make a change, what benefits would you expect?
I'd like to think I'd have some more money.
More money. That's
Yeah.
a good one. That's a really good one.
Hopefully I'd be able to see my kids and there won't be a problem with seeing my kids.
Yeah. You probably get more access to seeing your kids, wouldn't you?
Well, I mean, I would hope so. As I say, some people have said that they think there could be a problem with me seeing my kids if I've been drinking. So.
Yeah. Anything else? What other benefits would be really good about stopping drinking?
Hopefully I'd be a bit healthier, maybe. Like I say, I
Yeah?
don't know too much about
Yeah. But
about the health
I
effects.
did say that there was lots of risks, so yeah, you'd be healthier for sure. Anything else?
I'm not sure. I think that covers most things.
Okay. Great. And what are the downsides
The downsides
of making a change? So
making a
probably
change.
not that many.
Well, I mean, I'm not really sure how I'd relax in the end. I mean, as I say, I do use it to help me relax and help me feel better after a stressful day. So I'm really not sure. No, how would I cope?
Okay.
I'd be worried about that.
So
I
you
wouldn't
need
see my
some kind of
friends.
either like stress reliever.
Yeah, I would need
Yeah.
something to try and, you know, and
Okay.
I'm not going to see my friends anymore because I normally see them when I'm
Yeah.
down at the pub.
Well, I've got lots of ideas of other ways that you can relieve stress because I actually cut down myself a few years ago. So there's lots of ways we can help you do that. So that shouldn't be too much of a problem. Anything else?
I don't think so, really.
No, just not sure how you would relax, but
Yeah, I
Okay.
think that would be my big worries. You know, how would I cope with things?
Okay, yeah, but like I said, I've got loads of ways that you could do that. So, if we summarise this, what's working for you now? It's kind of, you find drinking a bit relaxing, you like going to the pub to see your mates, but on the other hand, you're spending loads of money on this. People are judging you, you might get less access to see your kids, which you said is really important to you.
Mm-hmm.
It's got loads of health risks. And yeah, basically, in terms of your life, it's really not that great. However, if you were to make a change, you'd have loads more money, you'd probably get more access to see your children, you'd definitely be healthier, and you were a bit worried that you wouldn't have any kind of ways in which you would be able to relax and de-stress, but like I've said, I've cut down before, and I know lots of people that have, and there are loads of ways in which you can kind of de-stress rather than drinking, which is clearly bringing lots of other kind of bad effects with it.
Mm-hmm.
So now we've talked about all that, how sure are you that you think you want to make a change now?
I'm not really sure. I mean, I would really like to make a change, I think.
Yeah.
But I'm just not sure yet.
You're still not sure?
Yeah, it's just still not. I mean, on this chart, I'd maybe
really?
put,
Okay.
down towards the middle there, around about that 5.
About 5. Okay, that's disappointing.